In this video, we are going to discuss about the knee joint capsule. When we study a joint, we often take it for granted learning about the capsule. We often think that it's not much relevant and skip it off. But that's not the scenario here. In knee joint, the capsule do play a very important role and do require a special attention. The diverse clinical conditions like osteoarthritis, the destruction of articular cartilage, the proliferation of synovial membrane and joint effusion, etc. are all related to the joint capsule. And the study of joint capsule is very important. Let us explore about the knee joint capsule in detail in this video. The knee joint, you know that it is an incongruent joint. The femoral condyles are sitting on a flat, relatively flat tibial condyle. Of course, you have menisci, of course, you have a lot of muscles acting on. But this muscular reinforcement is not enough for the stability of knee joint. And you need the stability from passive structures like the capsule and the ligaments, without which the stability in the knee joint will always be a challenging thing or a hindered one. So knee joint capsule do play a very significant role in stability of the knee joint. In fact, the knee joint capsule serves three functions. The first one, it helps in stabilization of the knee joint. The first one, it helps in stabilization of the knee joint. It is a passive structure and it acts as a passive stabilizer of the knee joint. And second one, it contains lot of sensory and proprioceptive receptors. Sensory and proprioceptive role. The knee joint capsule, like the menisci, contains a lot of sensory and proprioceptive receptors. That is, it contains nociceptors and mechanoreceptors like Ruffinian corpuscles, Pacinian corpuscles, etc. This helps in sensory as well as joint proprioceptive feedbacks. So this has a role in sensory and proprioceptive role. And finally, it create or it act as a seal for holding the synovial fluid. Know that synovial fluid is very important, and this joint capsule act as a seal for holding the synovial fluid inside the joint space. So these are the three critical functions of a knee joint capsule. And when we evaluate, we see that knee joint capsule knee joint is made up of actually two layers. The knee joint capsule is made up of two layers. And the two layers are a superficial layer, and a deep layer. The superficial layer is also known as the fibrous layer, and deep layer is also known as synovial layer or synovial membrane. So the knee joint capsule is in turn made up of two layers. That is the superficial layer and the deep layer. The superficial layer is in fact known as the fibrous layer, and deep layer is known as the synovial layer. And you know that in the knee joint complex or knee joint is in fact having a medial compartment and a lateral compartment. You can consider it like that. Medial compartment is between medial femoral condyle and medial tibial plateau. Lateral compartment is between lateral femoral condyle and lateral tibial plateau. But the knee joint capsule is covering the entire joint completely and making it a single joint. It covers the patellofemoral joint and the tibiofemoral joint. It covers both articular surface. It covers all the compartments. So that knee joint has a single, large and loose capsule. that is the knee joint capsule. And as I told you, the capsule in fact is made up of two layers, that's the superficial and the deep layer. Now we go on to discuss the each layer of the knee joint capsule. And before that, something important, the relationships of knee joint capsule. In general, knee joint capsule, we can say that it runs from inferior surface of the femur to superior surface of the tibia. For example, you know that this is the femur, the inferior surface of the femur, it starts and it covers up to the superior surface of the tibia. So this knee joint capsule covers the superior surface of a tibia and inferior surface of femur condyle in general. Okay? Generally, it runs from inferior femoral condyle to superior tibial surface, tibial plateau or surface, right? That is the in general. But what about the anteriorly? Anterior portion, the anteriorly, the knee joint capsule contains the patellar tendon, the quadriceps tendon and the patella and the layer covering that. So the anterior portion, the knee joint capsule contains the patellar tendon, the patella and quadriceps tendon, and that is together known as the extensor retinaculum of the knee joint, along with medial patellar retinaculum and lateral patellar retinaculum. We will discuss that in detail later. No need to worry about that. So anteriorly it forms the extensor retinaculum. Extensor retinaculum, or it is reinforced by the extensor retinaculum. Posteriorly or posterosuperiorly, it is attached to in posterior margin of femoral condyle. You need that this is the posterior aspect. Here it is attached to the inferior margin or posterior margin of the femoral condyle and intercondylar area. The posteriorly, the capsule is attached to the in posterior margin of the femoral condyle and intercondylar area. That is the importance of a knee joint capsule posteriorly. And inferiorly, it is attached to the posterior tibial plateau or posterior tibial condyles. So inferiorly, it is attached to posterior tibial condyles. So postero-superiorly attached to the femoral condyle and intercondylar area, postero-inferiorly attached to the tibial plateau. Medially and laterally, this is reinforced by the capsular ligaments. So that is a general relationship of knee joint capsule. What is that? It is rising from inferior surface of the femur into the superior surface of tibia. Anteriorly, it is related to the extensor retinaculum. Medially and laterally, it is reinforced by the capsular ligament. Posteriorly, it is attached to the posteriorly attached to the posterior margin of femoral condyle and intercondylar area. Posterior-inferiorly attached to the posterior tibial condyles. Now let us discuss the first layer of the capsule, that is the superficial layer or the fibrous layer of the knee joint capsule. Fibrous layer of the knee joint capsule. To understand this fibrous layer, we need to draw the diagram of a knee joint, an anterior relationship of knee joint. You know that this is how the knee joint is, right? And you have a tibia over here, right? Yes, and of course over here you have your patella, right? You have over here your patella, okay? And now from here to here you have your quadriceps tendon coming, the quadriceps tendon, yes, and here you have the patellar tendon. Here you have the patellar tendon. Now this fibrous capsule or fibrous layer is the superficial layer. I told you is the superficial layer. The role of the fibrous layer, it provides some passive stabilization. So this is the layer of the capsule that provides the passive stabilization, not the deep layer. It is a synovial layer that is not providing the passive stabilization, but the fibrous layer provides the passive stabilization. This fibrous layer contains lot of capsular ligaments. We are going to discuss about those capsular ligaments. Now you see, this is the anterior portion. This anteriorly, the quadriceps tendon, okay, the patellar tendon and the patella along with the fascia covering it together forms a structure over here. That structure is known as the extensor retinaculum. But extensor retinaculum also contains two additional structures. What are the? This is the medial side, this is the lateral side. Here you have a thickening of the extensor retinaculum or anterior border, and that is known as the medial. That is known as the medial patellar retinaculum. Medial patellar retinaculum. And here you have an additional thickening that is known as the lateral patellar retinaculum. Lateral patellar retinaculum. Okay, lateral patellar retinaculum. Now, what is extensor retinaculum? Extensor retinaculum is actually this total structure which contains the quadriceps tendon, the patella, the patellar tendon, the fascia covering quadriceps tendon, the patella and patellar tendon, along with medial and lateral patellar retinaculum. That anterior structure is known as the extensor retinaculum of the knee, or extensor retinaculum of the knee complex. So what is that? Once again, it contains a quadriceps tendon, patellar tendon, the patella, the medial and lateral patellar retinaculum. This together forms the patella knee joints extensor retinaculum. Now, if we see over here, right? Let me rub this one. Yes. Let me take it out. Yes. Okay, we don't need that actually. Now you see that this is the medial patellar retinaculum. Okay, this is the medial patellar retinaculum. This medial patellar retinaculum is having an additional thickening which arises from the arcuate adductor tubercle, which arises from the adductor tubercle and is attached to the muscle in the medialmost compartment, that is your vastus medialis muscle, and is attached to the vastus medialis muscle, and finally attached back onto the patella. This structure is known as medial patellofemoral ligament, and that structure is known as medial patellofemoral ligament. What is that? Medial patellofemoral ligament. That's very important structure with regard to stabilization of your patella. This is one of the greatest or most important structure which provide a passive stabilization to the patella. It helps patella to rest in the femoral sulcus. So if there is a damage or sprain to this ligament, patella can move out of the femoral sulcus and lead to lateral displacement of the patella. This side displacement of the patella is known as lateral displacement of the patella. So the passive structure that prevents that is the medial patellofemoral retinaculum. It is actually a thickening of the medial patellar retinacular band, right? And now similarly you have the same structure in the lateral side. Okay, lateral side you have lateral patellar retinaculum. This lateral patellar retinaculum also shows a thickening, and that thickening is attached to the IT band. It is a little oblique, not completely horizontal, and that structure is known as the lateral patellofemoral ligament, and that structure is known as lateral patellofemoral ligament. Right? So we have two important structure, one in the medial side, medial patellofemoral ligament, and lateral side, lateral patellofemoral ligament. Now you just guess, let us make some guess. That is, we have the patella over here, right? How to make this study easy? We have the patella over here. Okay, patella, it is related to the femur. Patella is related to menisci, right? Patella is related to tibia. When patella is related to the femur, you have the two ligament, medial patellofemoral ligament, lateral patellofemoral ligament. When patella is related to menisci, you should have medial patellar meniscal ligament and lateral patellar meniscal ligament. So that attaches the patella to the menisci, which is actually seen over here. You have your knee joint menisci over here. So this structure attaches the patella to the menisci. That is a medial and lateral patellomeniscal ligament. That is the second capsular ligament. The first one was lateral and medial patellofemoral ligament, then patellomeniscal ligament. Now patella is related to femur, patella is related to menisci, patella has to be related to tibia. Okay, there should be some stabilization. This is medial and lateral patellotibial ligament. Medial and lateral patellotibial ligament. This is having a slight oblique orientation. This is having a slight oblique orientation, and it will be oriented like this. This one is known as medial patellotibial ligament. This one is known as lateral patellotibial ligament. Lateral patellotibial ligament. See, lateral patellotibial ligament. So these are the capsular ligament complex that are attached to, or capsular ligament modification that is seen on the fibrous layer of the capsule or related to the patella. That is medial patellofemoral ligament, lateral patellofemoral ligament, medial patellotibial femoral ligament, lateral patellofemoral ligament, and medial and lateral patellomeniscal ligament. Right? Don't forget about the extensor retinaculum and this one. And finally, posterolaterally, the patella is related to the arcuate ligament, that is in the posterior aspect. We are not able to draw here. We'll see the diagram. That is the oblique, that is arcuate ligament, and posteromedially patella is related to oblique popliteal ligament. See how many ligament complex are actually the modification of fibrous capsule, which is the extensor retinaculum, which is the medial patellofemoral femoral ligament, lateral patellofemoral ligament, medial patellofemoral tibial ligament, lateral patellofemoral ligament, lateral and medial patellomeniscal ligament, oblique popliteal ligament posteromedially, and arcuate ligament posterolaterally. That's all about the fibrous capsule of the knee joint. And now we move on to study about the synovial layer or deep layer of the knee joint. The synovial layer is quite important. Why? Because it is a deep layer, and it is the one that is producing the synovial fluid, and it is in this synovial fluid cavity that the synovial fluid is actually there. And that synovial fluid helps in the nourishment of articular cartilage, menisci, and all those avascular structures. You know that menisci, the articular cartilage are avascular highly, not completely, they are not having vascularity. So they receives the vascularity, or they receive the nutrition from the synovial fluid. So synovial fluid is very crucial for the sustenance of the passive structures inside the knee joint, like the menisci and the articular cartilage, etc. Now let us see the synovial layer of the knee joint. Synovial layer. This is quite important because it has the synovial fluid, which helps the nourishment or nutrition of the passive structures inside the knee joint, like the articular cartilage and the menisci, etc. And now the arrangement of the synovial layer is quite complex. The arrangement of the synovial layer is quite complex, but we will try to make it in a simplified manner. How to remember and correlate the arrangement of the synovial membrane or the deep layer of the. Yes, let us see the relationship. So this fibrous capsule is the first layer, and posteriorly this synovial layer breaks out from the fibrous layer. So it breaks out from the joint capsule or a fibrous layer posteriorly, and anteriorly this synovial layer is seen associated with your ACL and PCL, that is the anterior cruciate ligament and posterior cruciate ligament. So ACL and PCL becomes intracapsular, but extra synovial, because synovial fluid is not, synovial layer is actually invaginating it and going out, so it is not covered or it is not inside the joint cavity. So that is the peculiarity. Anteriorly, it is related to your ACL and PCL and reinforce and makes the ACL and PCL intracapsular and extra synovial. They are surrounded, not surrounded by the synovial fluid, and they are located extra synovial, right? And laterally, this one is related to your popliteus muscle and lateral collateral ligament. Medially, it is related to semimembranosus, the medial head of the gastrocnemius, and medial femoral condyle. Once again, laterally it is related to lateral femoral condyle, not lateral collateral ligament, lateral femoral condyle and popliteus ligament muscle. Medially, it is related to semimembranosus muscle, gastrocnemius muscle, and medial femoral condyle. Again, let us summarize the synovial fluid or synovial membrane. The synovial membrane actually breaks out from the joint cavity posteriorly. So posteriorly it comes out from the fibrous layer, and it is related to various structures. It is related anteriorly to the ACL and PCL, making that intracapsular but extra synovial. Posteriorly or posterolaterally, it is related to your popliteus muscle and lateral femoral condyle. Medially, it is related to your medial femoral condyle, gastrocnemius muscle, and the semimembranosus muscle. So that is a relationship of your synovial membrane, right? And synovial membrane, as I told, is helping in is actually producing the synovial fluid, which is very important crucial for the joint sustenance of the passive structures. And synovial fluid in the knee joint, if you look, we contains lot of fat pads. There we see lot of fat pads like suprapatellar fat pads, infrapatellar fat pads, etc. So these fat pads are layers of fat which reduce the friction, not bursa, but fat pads. But this synovial fluid is not covering those fat pads. This is just for information. If you need, you can get it, otherwise just leave it. But what is more important is during the birth or during the in embryonic stages of life or during the fetal period, what happens is that your medial and lateral femoral condyles or patellar tibiofemoral joint are actually covered by a separate joint capsule. But after synovial membrane, but after the 12th week of gestation, by the 12th week of gestation, it becomes one. When it becomes one, it becomes a complete single joint capsule. But sometimes there may be remnants of the previous joint capsule, and that results in condition known as Plica or Plica. And we discussed about Plica earlier in a video, very complete. We had a complete discussion on it. If you need any more, if you have any doubts on the Plica, just look back into the link, and the link is given above. So that is another application of the synovial layer. That is, the synovial layer remnants may be present in our body, in the knee joint, and sometimes that can result into condition known as patellar plica and clinical condition known as patellar plica syndrome or patellar plica syndrome. That's all about the knee joint capsule. Of course, the knee joint capsule is quite important. Don't skip it and relate it and study. With the following diagrams, we will understand the knee joint capsule much more. In this diagram, you can see the synovial membrane of the knee joint capsule, the lateral collateral ligament, the infrapatellar bursa, and all the lateral meniscus, etc. So these are the general relationship of the synovial membrane. You can see that invaginating between the lateral femoral condyles and all the associated structures. And now in the coming diagram, this shows the stabilization of patella, medial patellofemoral ligament, the vastus lateralis muscle, the quadriceps tendon, you can see the lateral patellofemoral ligament, the IT band, you can see lateral patellotibial ligament, medial patellotibial ligament, and all the structures. And in center, you can see the patella. With that, we wind up this session, and if you like the video, don't forget to click the like button, and if you haven't subscribed to the channel, do subscribe to my channel.